Every 1 in 8 women in her entire lifetime is diagnosed with breast cancer. About 60% of women in India get diagnosed at an advanced stage of the disease. Hi everyone, I'm Dr. Ashwini Priyadarshini Singh, and today I'm here to tell you about something about breast cancer, which is one of the leading cancers for female across the world. And for that matter, is the second most leading cause of death in cancer related deaths in women. So, what are the signs and symptoms that you can see in yourself as far as breast cancer goes? So, first of all, is a palpation of a lump in your armpits or in your breast tissue. Second is a little bit of morphological changes in your skin. That is a retraction of your skin, a little bit of dimpling, a little bit of puckering. Third is discharge from your nipples. You can, experience certain discharge coming out of your nipples, either both the nipples or one of the nipples, and there can be retraction of your own nipples as well. So if you happen to see one of these things, then there is a chance that you might have a malignant underlying malignant pathology down there, and you should immediately report to a doctor. Now, most commonly asked question, which doctor to report to? You should ideally go to a surgeon. They will be planning your treatment and also be diagnosing whether you have a breast cancer or not. A very common question which is asked to me is about how breast cancer exactly occurs and what are the risk factors involved with it. So, breast cancer basically occurs because of a BRCA mutation in your body. There is a gene in your body called the BRCA gene. It naturally occurs in every individual, may it be male or female. Yes, even males can have breast cancer and also have the ability to transmit it. So, having a BRCA gene mutation leads to multiple division and unstoppable division of the breast cells, and hence it leads to breast cancer. Now, say you have a family history of breast cancer and you want to know if you at all you're at a risk or not. Then there are blood tests which are available by which you can get yourself tested for a BRCA mutation and you can know. And a very, very common and for that matter, very recent modality which has now come up mostly now in the mess that people get a mastectomy done if at all they've had a history of breast cancer in their family, because they are just removing the target organ from their body altogether. Now, what are the risk factors? Like any other cancer, consuming alcohol, smoking, having a lot of preservative laden food, having a poor lifestyle are certain risk factors. But you will fall in the high risk category of breast cancer if you are a first or a second degree relative of someone who's had breast cancer. If you yourself, in your family obviously, if you yourself have had breast cancer in one of the breasts, and hence there is a chance that you can have it in the other breast as well. Thirdly, if your chest, mostly the chest, has been subjected to some kind of radiotherapy, say for lymphoma, etc., etc. Thirdly, if you have had hormone therapy, and fourthly, if you have had early menarche or late menopause, or you're a lactating mother but you're not breastfeeding. So these are certain high risk categories. Most important, I feel, as a doctor, is having a family history. So you guys need to be a little vigilant, right? Now, what are the treatment options which are available in breast cancer? Is it curable? Yes, if diagnosed at an earlier stage. If there are treatment options by which breast cancer can be cured, but again, this does not go for everyone. It will depend on how your body is responding to treatment and how it is going in you. But yes, there are good treatment options available which can make you completely cancer free if at all it is the disease is picked up at an earlier stage. So the treatment options are surgery, radiotherapy, chemotherapy, hormone therapy, and targeted therapy. So by all this, you can obviously live a completely disease-free life. Then, what if we don't fall in the cancer group at all? How do we go about preventing it? So, to all the boys and girls out there, yes, boys as well, all the ladies in your house and all the ladies out there who are above the age of 40, you should get your annual mammogram done. If you're a lactating female out there, please feed your baby. Thirdly, if you're in your 20s and 30s, then you should do something called a monthly self breast examination. Monthly self breast examination is basically touching your own self, touching your own breast, touching your armpits. But how to do it?